All right, Grand Rising. Good day, good morning. Welcome to you all. You are tuned in to the one and only Peak Wellness Hour. We're so excited to be here with you all. So, really quickly, we're doing supplementing your income through health and home care options. I don't know why I chose the intro picture that I chose with the world in the hands. But I do feel like I don't know why I chose it. It was a last minute decision. But I do feel like this is a great time for us, in our local areas, across our cities, our states, the country, the nation, the world, to kind of hold hands and come together as we are dealing with financial crisis um, and financial illiteracy. Okay, so that's how I'm gonna justify that picture, that start of that. You all get your pen and paper. We're going to have a great conversation. We weren't here last week, but we are here live and ready to empower and be empowered. So stay tuned, grab your pen and paper, tag a friend, ask somebody to come join, and let's have this conversation. We'll be right back. Okay, welcome back. This is going to be a fun conversation. I'm excited. I know when Queen Edith and I talked about big, it's a serious situation that we're talking about when it comes to wanting to supplement your income, and not just to have more money, but to be able to sustain our lives. So as I'm in brain mode, you all. I'm gonna show you what I mean. I'm in brain mode. So we were having technical difficulties. So thank you all for waiting and joining with us now. But here's what I put. Okay, it says, "Come on in, family. We're having some technical difficulties. We will begin shortly. Thank you for your patience." Do you see what I did?
Patience.
So I went back. I'm in nurse mode. I'm a nurse, so I'm patient this and patient as I'm charting. So I was in nurse mode this morning. So forgive me for that. I do know the difference. But with that being said, we are in the healthcare field, and we are here to have this conversation with you about supplementing your income. And you all know I love talking about that as far as empowerment and financial freedom. But we're going to tie it in with some options, with home care options, healthcare options, where you're not necessarily having to, go and get a 4-year degree. And this is going to be tied in with balancing and putting family first and self first, and still being able to survive financially and holistically. So, with that being said, I feel like I talked too much already, but I'm gonna have Queen Edith bring us in like I just ain't been talking this whole time. Queen.
Well, well, I hope you guys had a great Easter. Okay, we thought it was worth taking time and reflecting. For me, I believe for Queen too.
Mhm.
So, and sometimes we need it. We love you, but sometimes we all need it. I'm talking about patient and patience. When I was a child, the hospital we used to go to was on the door of the doctor. Right next to the door was a sign. It says, be a patient's patient, be a patient's patient while the doctor is attending to another patient. It could be you.
Mhm.
Well, I don't know. This is elementary school, like
Mhm.
primary school, elementary school. And that, I have never forgotten it because it was so, be a patient's patient while the doctor is attending to another patient. Remember, it could be you. So all these patients, patients, patients.
Mhm.
Hi, Ken. How are you doing, Theo? So all this patient thing could be a little confusing. So yeah, nurse mode. But good day, good day, good day, good day, good day. How are you all doing? We thank God for another week. We thank God for all the amazing things He's doing in our lives. You may not feel it, you may not see it, you may not even experience it, but the fact that you still have breath in your lungs, there is hope. Okay, there is hope. Don't give up on you. I also want to say that since we are talking about finances and supplementing your income, there's a website that I like to share with you. It's called sankofawealth.com, SANKOFA wealth.com. Check it out. There are some amazing resources there. It belongs to a friend of mine, someone I know very well, and he's passionate about teaching financing and ways to manage and take care of our finances so that we will grow money, have money, be able to live the life we want without the stress that sometimes you're going through. I've come to learn that financial situation is huge.
Mhm.
People look nice and look all dressed up and show up with a beautiful face. But people are struggling. People are struggling. In some situations, it's not because they don't want to work, it's because they can't find work that works around the family's schedule.
Mhm.
You may have little children. You have to get them off the bus. Not everybody can afford a nanny situation. And even if you have a nanny, maybe your income, most of your income is going to the nanny. So then, what is the point? Life is becoming tougher and tougher and tougher and challenges. And maybe you don't experience it, but some of us have and some of us continue to. And for some, it will always be a battle that we have to overcome. So today we thought this is a very practical thing to talk about. How are you making it? Especially single parents with children under 10, 9, 8, 7, 6, you know, who go to school, who brings them from the bus. You have to work 9 to 5. You have to worry about those things. Where do you even have the peace of mind to focus on the work you're doing so you can give it your best? So that you can probably even earn a promotion or earn an extra income because you're a great worker. Who do you know that you don't know are struggling? And this is the thing. Many of us don't know what people are going through because we don't want to talk about it. So today we thought we'll discuss it and look at some of the options available to us that could work with your schedule so you can take care of family, take care of you, and have that little extra income if needed, or that income if that's all that you're getting. Some people are getting from the government, but is it sustainable though? Is it sustaining you? So let's be real this morning. Let's talk. Share this video, invite a friend, and let's have this conversation. Thank you.
Well, I think I could really keep. I think it can really keep talking because I know that like we shared. This is what we do. Healthcare, the business of care is what we do. The business of care. because Queen Edith does so many different things. May 10th, graduation day. Super excited about that for
May
her.
9th.
May 9th. Okay, I'm sorry.
May
Yes.
9th. Graduation day is May 9th, and my
Okay.
apparel just came.
Yes. You should have brought it out so we could see it. So she's got the marriage and family counseling down pack. She's got the pastoral side of that down packed, and she is out doing her thing. So if that is something you are looking for, um, reach out to her. She's got some clients. I'm super excited. I know we don't violate HIPAA, but I just know that she's doing a great job out there. So you all, we're here for those connections. But my point is, we are in the business of care, not just healthcare. So it's kind of cool that this conversation, and like even with myself doing nursing, I do so many other things. I love life coaching. I love imparting wisdom into people. So it's care that we provide. But with this conversation, Queen Edith brought up a good point where with home care, which she has a business, Peak Home Care Associates. You all have to check that out. Um, it's about compassion. It's about servitude and understanding, being patient with patients, like she said earlier, and so we figured we stem the conversation from that angle where we could talk about how when you do have, family, we have people that are taking care of children and parents, or children and grandparents, or parents and grandparents, and that's a lot when there's no support system, or there's the lacking support system. That's a lot of weight to carry on your own. There's only so many hours in the day. So we're doing teenage stuff, the games, the outings, the birthdays, and we're doing mom and dad's healthcare needs. The equipment costs this much for the sports, the boost and the insure, and the incontinent pads and the medications cost this much for mom and dad. We still have bills. We still have financial responsibilities. And what happens when all this comes together and you can't afford on any level to maintain your mental health? Let's talk about it. Let's talk about some options, Queen.
And this is the reality of many families in our generation. People are taking, we are in the middle, taking care of mom and dad and taking care of our children. It's the reality. I'm in the home care industry and I see this every day. I see this every day. So I know that this is something that is going on. Okay, besides the financial responsibilities and burden, there's also the family responsibility. There's also the you responsibility. When are you taking care of yourself? Okay, and how do you balance all of this? One of the things I've learned in life, in my journey, is be even careful who you're leaving your children with. Whether you're taking them to the nanny's home or the nanny's coming to your home. The world has gotten quite scary. And for me as a Christian, it takes a lot of prayer as well to be sensitive, to know who is coming into your home. So we don't want to leave our children into anybody's hands. Appearances can be deceptive. So how do we navigate all of this, especially if you're single? Because sometimes couples can work, one can work in the night, one can work in the day. That way, there's always somebody with the children. But what if you don't have that option? There's so many jobs around that may be flexible, but since we don't know that. Being a home care owner, hiring caregivers, I've realized that a lot of my caregivers are mothers. Okay, they have to take their children to school. So you know you can't schedule them for 7 a.m. shifts. And then maybe they pick the children up 1 o'clock, 2 o'clock, 4 o'clock. So you know that when they come to it, what people, a lot of people don't know is that you can share your availability with in the home care industry. This opportunity is there. And I know that there are other opportunities in the healthcare and other areas. Okay, so in the home care industry, there is flexibility. Okay, as a home care owner, one of the things we ask our clients, I see my employees as clients because they make the business go. They are the face, so they are my clients. What is your availability? What hours can you work? What hours can you not work? And people will say, I have to get my children to school, so I can't do anything before 8 a.m. But then again, I have to get off work by 1 p.m. so I can get my children off the bus, be with them, feed them, do whatever it is they need, do homework. After all is done, maybe my mom, my sister, my brother, my husband, somebody, or their father, their mother can take care of them from maybe 6 to 11 p.m. So I can also work from 6 to 11 p.m. If there's a second shift somewhere, I can work those hours. Okay. And there are a lot of places where you can do that. People are going to assisted living places. There are the opportunities for respite care. Okay. Somebody needs a break, a little 4 hour shift somewhere in the day where it's flexible to you. That flexibility is there. So you will be able to make time to take care of your children. It may not be a whole lot of income, but it's income you did not have. And before I let Queen come, but before I let Queen come in, I'm going to throw a question. Somebody will ask, what if I've never done this before and I don't have the qualifications for it? I'll let Queen come in and we will talk about that, Queen.
Well, I was gonna ask. That was part of where I was gonna follow up with when you were finished, Queen. Was what does that look like? We're having this conversation again. There are so many ways that you can supplement your income, and it's different things that work for different people. We're just given this option because it's an awesome option. Again, this is what we do. So I'd say, would you like to explain the difference? Because a lot of people don't have an understanding of when you hear home care versus healthcare, medical versus non-medical, and what that looks like as far as timing, qualifications, um, and the biggest thing is why. If you don't like people, if you are not patient, if you are not respectful, there's a lot of things. It's not for you. Okay, this is all money is not good money. Okay, but if it's
Right.
something where you could, it's an option. I don't want to sound like I'm knocking anything, because I'm not, because we all have to do what we need to do right now. And this is just an awesome option. I think that with home care, you do have that option where you're not in a facility necessarily. You're not doing extraneous activities. I've worked in facilities in senior communities for a very long time, and I'm a home health aide, or home health, excuse me. I'm trying to produce and put this stuff up. I've been training an awesome home was hired, well, with the company I'm with. So I'm sorry, but I've been doing nursing and home care for some time now. And you see the compassion, you see the time where you're not overworked. The money is different with being in a facility, but they're paying you to do that work. And we have a lot of people, like I said, that are taking care of children and seniors. You're tired. People don't want, and as I know as I get older, I don't want to be bending on, pulling on, lifting on people on a consistent basis as I get older. So this is a great option for people that their bodies, you just want to take care of your body a little differently because you're a little more fragile than we were 18. Can we all agree with that? You know, and if you are under 21 in here, please put a hashtag 21 or something. I might be talking to the wrong
Yes.
audience, you
Oh,
know. But
hashtag
I know,
20s.
I
Yes.
know what that feels like. So this is an awesome option where we're talking about companionship. We're talking about spending time. We're talking about meeting needs. I have a I have I am aware of someone that is a senior and she has a paid caregiver. This woman does not cook. This caregiver does not cook. The problem is this senior is unable to move around. They can't
Mm,
get up and stand up long enough to cook.
mm.
And so now they're eating processed foods, microwave foods, these things because that's what they have to eat because they
Right.
prefer to cook a healthy meal. But they can't. But now you have a paid caregiver that's a paid caregiver, meaning paid. She paid for it. Okay. And it's not chump change. So I expect personally that care be provided adequately. But when she's spending money every day eating out because nobody's cooking, that's what I mean when I said earlier, if it's not for you, it's not for you. If you can't meet basic needs, but these are needs that, can you make a bed? Can you separate whites from darks and throw in a load of laundry and fold and put? You have no idea the benefit that it serves for someone else. You know, I have people, like I said, I've been training someone for home health aid, and it's not beneath me to give a shower, to toilet because of a title or a position or letters behind my name. So I've actually enjoyed it. I've actually enjoyed going out and giving showers and hanging out because it's a time where somebody's vulnerable, and in their most vulnerable state, you're there to help them. And it's something they need, but they don't want to have to need. Nobody wants to be assisted to the bathroom, assisted with cleaning up. Nobody wants that. So that's kind of my thought on the benefit and just kind of justifying, the qualifications for me in my head as to why you should or shouldn't consider something like that. But it's good time spent, especially if you have children, if you have senior parents or grandparents you're taking care of. It kind of connects all that, that care as a parent, that care as a child for your parent, and it kind of bridges that gap when you're taking care of someone else, and giving that love. So that's my spill on that, Queen.
I'm looking at my name down there and I'm seeing MFT in training. I am no more in training. I am no more in training. Anyway, hey, I see my sister. Hey, Queen Sis,
I
how
am
are you doing?
here. Say, I am here. I have graduated.
Listen, you asked a very you raised a very important point in the beginning, and you've raised a lot of important points, and I'd like us to take each one and go into it. One of the first points is the difference between home care and home health care. I don't know if it applies to all of the United States or everywhere else. I know about the state of Indiana. So that is where I am coming from. Find out what they call it in your state. But in the state of Indiana, home care is non-medical. So that means it's non-skilled, and it can be Medicaid sponsored or Medicaid certified or Medicaid, whatever. Home care, when it's just home care, peak home care associates. We do non-medical, non-skilled. I'll break down the difference for you. I'll break it down. When you see home health care, then they are medical and they are skilled. Home health care has physical therapists, has occupational therapists, has nurses visits. Okay. Some home health care agencies also have home care attached. Okay. Home health care can be sponsored by Medicare, which is federal. Okay, home care, no, only the state, which is called the Medicaid. Okay, now let's break it down. Home care, when we say non-medical, good morning, Suzas. Okay, when you say non-medical, it means that we do not give medication from, we don't, how do you put it? We don't administer. We can open the bottle for you and help you get your meds yourself. Or the nurse has set the medications up in a pill box. Okay. And so we know Monday, we know what is in Monday's box, we give it to you. We know what is in Tuesday's box, we give it to you. We are not medical. If we see that Monday morning and Tuesday morning look different, then our job is to call the nurse and say, I see that in Monday there are 6 pills, in Tuesday there are 5, in Wednesday there are 6, Thursday, but Tuesday has only 5 pills. It is not our job to tell you what the pills are. So we are non-medical. We don't do medical advice. We don't do what the nurses do. The non-medical, the home care, come in as companions. So companions, we help you with showers. We help you with meal prepare. Actually, we do the fun stuff. We help you with meal preparation. We help go run errands, go grocery shopping together. If you are someone who can go get your nails done, go get your hair done, go and make the bed, make laundry. Make sure you are living in a clean environment. Sit down, engage you. Make sure we have a conversation. Make sure you're drinking your water. Ensure you're eating. If you're full risk, ensure that when you get up to work, we are right next to you. We can grab you. We fall prevention, so to speak. Okay, so these things, you don't need a whole lot of skills, nursing skills. Change you in bed if you're bedridden, help make sure you're clean, skin care, ensure that we are moving you as often as possible every 2 hours, stuff like that, so your skin doesn't break, stuff like that. Those things you can be taught. And if you are a parent, you are an auntie, you babysit your nephews, your nieces, you have a mother, you have a father. There are a lot of common sense things. We require that you observe when you're with somebody for a particular period of time, for a period of time. You can notice changes and you can call your office or whoever and say, hey, I noticed that Queen G today she hasn't used the bathroom for 3 days. So Queen G seems slow. She seems to be slurring, stuff like that. Being aware, it takes being present. And Queen G said something. All money is not good money. If you look at my field, I'm a therapist, I'm an entrepreneur, I'm a pastor. All people. If you put me behind the computer, And that's one of the first things I learned, data processing and coding, when I first came to America. Queen, I hated it. I hated it. The money was good, but I hated it. I was sitting down with computers all the time. I wasn't having human interaction. Edith was born to be around people, to love people, to care for people. That is me. Put me around people anywhere, I will thrive. I will thrive because my heart cares. My heart loves. My heart wants to help. I was born into the helping profession, helping ministry, helping whatever. So it doesn't matter where you put me, as long as I'm dealing with people. Because I so much want to help, I want to learn to help. Queen G has done showers with me before, right? She's done showers with me before. My caregivers know. We have cases where sometimes they need two people. I go to the office in scrubs. I'm not required to. But I go to the office in scrubs because I want to be able to jump up and help. I have caregivers who need to move a client, do something they couldn't. I jump up and I go and I help. I've done bathing with my caregivers. It's not beneath me. I want to do it. My heart is in it. I will run to do it. I like to see the satisfaction of somebody's face who says, "Thank you so much. God bless you."
Mhm.
I
Yeah.
tell you, we had this client. Oh my God. She wake up like probably every night, and I will go there. I'll go work some of the night shift. And she knew that it was a bother. She couldn't get up and go to the bathroom. She'd call every hour. And I will go and we will have conversations. I'll be gentle and patient. And when we are done, she says, "Edith, God bless you so much." And that just made, listen, I'm getting emotional. That just made my day. And one day when she found out I was a pastor, she started calling me the preacher. Every time I go up there, "Hey, are you the preacher? Oh, the preacher. Oh, I missed you." Eh, For me, no amount of money could replace that. That
Mhm.
is who I was born to be. So if you had, when I'm hiring, one of the things I look for is the person who has the heart for people, who is not looking for just income, to go and sit there and be on their phone and play and just get up and, "Oh, do you need something? Do you want something? Oh, it's lunch," and then you're off your plane. Like,
Mhm.
they sit there. So one of the biggest requirements for me as an employer in this field, do you have the heart for the people we are serving? Do you have the heart? And I was going to say, and I used to say, can you treat them like you treat your mom? Queen G taught me quickly. Not everybody loves their mama. Not everybody cares for their mama. You taught
No.
me that quickly. I learned that from you. So at least yourself,
Mhm.
someone you love. If you have the heart, we can work with you.
And I do love my mother, y'all. So that's not why I said it. I'm just saying.
Yeah,
I do.
oh yeah.
But yeah, it's just so true. So true, though. So
Yes.
true.
And it's
Yeah.
true. I've met people who haven't talked to, they don't want to talk to their mom, they don't want to talk to their dad, they don't want,
Mhm.
there's a history there I don't know. And I'm not judging, I'm just saying, like, it's true. You find out that people, it's the heart. Queen Randa, that's right. Queen Mother Randa, that's right. It's the heart. So one of the first qualifications, so are you thinking, "I have never done this, I'm not qualified"? Skills can be taught. If you care enough, you would want to learn to support.
Well, there you go. I love. You know what? You know what? You said something. You were talking earlier about you jumping in. as far as with all your many ventures with Peak jumping in and meeting that need adequately and swiftly. That's the beauty of it. You all, and I've said before on this platform that this queen comes out looking flawless, like she has gotten 8 good hours of sleep, like she's drinking her fluids, like all this stuff is happening. And she looks her makeup, or she didn't wear a lot of makeup. Her face just looks lovely.
Thank you.
But she's been out on assignment, and she comes in looking refreshed, and not that she's not tired, but my point is that flexibility. She's been in school. It's only been the past couple of years I realized that she was in school. She's just been moving, and then doing this, home care, and not just running the business, but actually being able owning the business. I won't say running, owning the business and running. But she's been able to be of support in those situations, those caregiver situations, those companion situations. And that's the flexibility that we're talking about, where things happen like that. I know with healthcare companies, home healthcare, it's just 9 to 5. Y'all know 5 heartbeats. My office hours are 9 to 5.
Right.
There is no respite. There is no after hours. We have, there are after hours numbers where you call, but with home health care, like nobody's coming out, you're more likely going to go to the hospital if there's a situation. Hospice is different. Hospice, there's a need, after hours need, people come out. With home care, are you laughing at my 9 to 5 queen mother? If y'all ain't never seen 5 heartbeats, you got to watch it, and it's funny, and then watch it again, and it'll be funny to you. So yeah, with home care, there is that respite option. There are different resources. Those are those nighttime shifts, those overnight
24/7, yes,
yes,
Monday through
the living
Sunday.
shifts, or the living situations, so those are the differences, and that's where you get that flexibility or whatnot. So yeah.
Yeah. And with home care too, like she said, it's 24/7. Okay, we are there, we are observing. So what it does is also gives the family break. They know that these people are there, they were eyes and everything, and communication. So the question on the floor is this: where are you struggling financially? Everybody can't create content and make money. Queen and I have been here for what? I haven't made any money from here,
No.
and we're still figuring it out. A lot of things are not instant. Okay, working in facility may pay you a little more than when you're doing one-on-one care. Okay, the beauty about one-on-one care too, if you're even a little older, you can lift. We can find you a client that's more companionship based. So it's not too hands-on, because companionship based, you can go pick up what's missing here, clean out the pantry. Oh my God, one of the things I've come to find out with seniors, okay, you go to their pantry, their food, a lot of things have expired, not just 1 month, years. We go through the pantry, we take out the things that are expired because they don't know. Okay, some of the seniors, when the weather changes, the heat is still on and it's summer, they're freezing and it's winter. Just being there, having an eye out there, being attentive. Okay, being attentive to them. What is going on? What is needed? What are they eating? Some people we had a client, and I remember when we first met the family, they said, what was he eating for breakfast? a protein bar. I'm not saying there's anything wrong, but this is a person. I'm not going to say male or female or anything. This is a person in his 80s. And the first time we went there, I asked the question. I said, would you like some bacon, sausage, eggs? Do you like that? He said, yes. There was nobody there. He was alone. I gave it up. This person was alone. There's nobody there to cook for him. So he will just have a cup of cereal. But as you get older, feeding your muscle is good. So your muscles will be strong. Protein is good. I remember the first day I asked the family, they delivered some groceries. We said, your parents says they like this and that, so give us, get us some or let us go buy it. So they did. Queen, the caregiver gave and made us some eggs and sausage and whatever it was, toast. This person ate. And he said, oh, I haven't had this in a while. Can you imagine? All they need is somebody. Most people can do this. If I will always add, if you have the heart that cares. Because if you care, you ask questions. If you care, then you're looking out for what can I do? What games can we play? I had a client who liked what do you call that thing? The puzzle. We can sit there almost all day doing puzzles. When she's doing puzzles, she will eat. You
Okay.
bring the food, we said that she doesn't think about the food because normally she doesn't want to eat. She doesn't think about the food. She'll eat. She'll eat the food and we'll go back to puzzles. It was fun. I love doing it. I enjoyed it. So you explore. It's an adventure kind of thing. Okay.
Right.
With home health care don't do companion care. They come to do the skill. The nurse comes, check her skin, check their bio, what do you call their bios, ask questions, ensure that medically they're doing well, their medications are set up, everything that is needed medically in place of the doctor himself. They do all that. They come in place of the doctor and they report to the doctor. So let's just say the doctor, the home care, home health care, then the home care in that category. We are the bottom. We do the fun parts. Our part is the best part. Yes, but everybody plays their role. Okay, but
Yeah.
you are the one with the client. You come with life, you come with joy. And I do get that people are going through a lot, but we come with joy. And it's so important that when you get to the door of your client, whatever it is that is burdening you, you leave it there. Because one of the things I've come to find out too is that, so we are sharing all these things so that option is there. If you need that extra time or if you need that little money, even to pay a phone bill, okay, to pay an electric bill that's getting ready to be cut, to pay whatever, that supplemental income, just for you to buy you something nice once a while. Put in a savings account. Even if you're going to do this for just a year, build up your savings. Okay? You come with joy. You don't come share your burdens. I've come to realize that when we go to these clients and you bring, I wouldn't say bad news, but you say, oh, I'm so sorry today. I was a little late. My son didn't sleep at all night. My son has been sick. Believe you me. You go and they're worrying about you and your son. They're worrying about you. Oh, I was so worried about you. How is your son doing? First thing they tell you when they see you. We don't want to do that. So we have to use a lot of discretion. Yes, and I'm sharing these because there's someone asking, what else can I do? Other people will go clean houses. take an hour, 2 hours, 3 hours, make that 120, 150, clean houses, maybe to clean two houses
Mm-hmm.
a day. And we have clients who needs their homes clean.
Mm-hmm.
We can partner with you and encourage our, oh, we have those people, they are bonded, they are insured, they have everything. We've done their background check. We have this service partner who does cleaning. So if you need someone to clean mom's house or clean that house, we support you. Partnerships, networking. But what can you do to get that little income? So whilst your children are at school, you can go and clean a house, make that income. People are doing transportation, Ubering.
Mm-hmm.
I have done Uber. I did Uber for almost a good year. I didn't like it. I met people, but I didn't like it. I sitting so much, running to public bathrooms when you need bathroom. You have to have this membership deal because you have to make sure your car is clean at all times. All those things, it's added, and money, gas, mileage. It's really, for me, it wasn't worth it for me.
Mm-hmm.
For me, it wasn't worth it. I mean, if I needed money instantly right here, right now, I can take this day and go drive and make $100 to pay that phone bill, to pay that gas bill, to pay that electric bill, whatever bill I need to pay right here, right now. I could do it. But for me, it wasn't sustainable. Some people are delivering food. Okay. So it is what will work for you, for
Mm-hmm.
whatever you need. But there are options there. And it is real. People are going through stuff. So how do we come together, support each other, push each other, until you can start making money on social media?
I'm not banking on that one. I mean, I'm not waiting for it. I'll say that. It's always nice. And you know what you said? Didn't I know a lot of this? We do realize that everybody that is in audience, whether now or later, is not in Indiana where we are. So I would like to think if this is something you wanted to do with home care, you would come to Peak Home Care Associates. But I would say that the knowledge that Queen Eve just gave as a CEO and founder of Peak Home Care Associates, that's something you want to look for when you're partnering with people in the healthcare industry, when you're trying to align yourself, whether you are an employee or you're contracted, right? Where people have education and information to share with you. There are there are opportunities for you to grow in what you do. Where you just, and I just mean sometimes even by the understanding of what you're doing, in that field. So I think that's so important. If that is not something, that's why I put in the title supplementing income through healthcare and home care options, because like Queenie have said, with the door dashing or the Ubering, I don't think I would want people in my car like that. Just period. I know I don't. It's not that I don't think. I know that I don't. But people do, and people like it, and it works for them. If you want to tie it in with a home care option, and here's where you all know I like that entrepreneur thing and that self-starter thing. Something so simple as partnering with somebody adequate in home care and saying, hey, I've got my CDLs, I would like to contract with you to help your clients get to the grocery store, get
Medical
to,
transportation.
yeah, get to doctor's appointments, because you have to realize that everyone that all because you're a senior doesn't mean that you have access to certain benefits. You think that you have the ride shares and the senior transportation, all these things, and sometimes you don't. Sometimes they're not covered under your Medicare. More times than not, Medicaid tends to cover everything, but that's a whole other discussion with the cost of things and how it's costly on the benefits overall. Never mind. But anyways, and then paying for that. So that is a service. When she talked about uh delivering food, maybe you can contract, and again, an entrepreneur mind, do a side catering thing, where you have time and you deliver you cook and deliver meals to seniors. They're healthy meals. Meals on Wheels, Mom's Meals, those things are nice to have. Those are nice benefits to have. Everyone does not have access to those. Again, depend on your insurance and whatever. But some of those foods are heavily processed because they have to make them in bulk, to serve communities, and you're doing it on a budget. So that's certainly an option. So just kind of think about those things when it comes. And I say that because here's the thing: healthcare is not going anywhere.
Nope.
Medicine is not going anywhere, So these are things that you can look into, and even find a craft in. Queen Edith, I did not watch her process with starting Peak Home Care Associates, but I know it's been a climb and it's a process, So it's lovely to have your own home care business. Shout out to my cousin. He's starting up something, and he's been talking about this for some time. So a lot of people are doing it, but then there's not enough. Here's what I found. Here's what I've learned in Indiana. There's not, or at least Indianapolis, there's not enough providers for all these home care agencies that are popping up, So that's an issue, and it's causing an imbalance with the rise and fall in healthcare companies. Okay, as far as sustainability. So there are opportunities out there if you don't want to be an employee. Again, there's ways to contract. You all look at I'll put it somewhere, but I was coming across, because I like taking continuing education courses. And if you go to Harvard has a bunch of free classes, like accredited classes that you can take, and they'll tell you how long these classes are for all kinds of different things, all sorts of different.
Right.
And you get a certificate from it. I mean, it doesn't matter where you take it. I just happened to stumble on it. I was like, oh wow, okay, Harvard, you're gonna pay for that certification though. But the information is free, but you're gonna pay for that certification. But sometimes the information is all you need, and not
Information,
saying I
yes.
came from Harvard, I came from I came from IU. You had the information and the wherewithal. And so having the information, having those opportunities and resources um, to grow your own thing and align it with healthcare, again, because it's not going anywhere, um, is an awesome choice. So just consider that.
You talked about transportation for seniors, right? And you talked about
Mhm.
CDL. You don't even need a CDL to have a medical transportation.
See, look at her, just
See,
dropping
you
knowledge.
don't need that. You may be having you are probably having a few, challenges, family, balancing all of this. You may have someone who could buy you a van. Your job, and you do medical transportation, and connect with home care agencies. Print out the business cards and then find them, visit them. I do have a van. I do have a wheelchair accessible van, and I have a good driving record. We can do a background check. So in case you need transportation to transport a client to dialysis, a client to back and forth, whatever it is you need, because we have clients who like to go to church on Sundays.
Mhm.
Okay, who want to go to church on Sundays, and all they need is someone to pick them up and drop them off.
Mhm.
Okay, and come and pick them up. Or you network with these people, and the Epic Home Care will market. Oh, we do medical transportation. We have, so these are partnerships.
Mhm.
Okay, and when something comes up, because we do not have a wheelchair accessible van, okay, and it's a whole lot of components, okay, but we can partner with you. We'll put it on our website. We advertise it. Somebody calls, oh, I have a client, I need transportation, blah blah blah, and I call you. We network. You don't need a CDL because it's not a huge car.
Okay.
Background check, make sure that you're not real, doing something or hurting
Mhm.
somebody, but that's all.
Mhm.
That's all. So that's why I'm saying that I think this is one of the very important conversations we will have on this platform. There are options out there.
Mhm.
I come from the mental health industry. It doesn't matter how much therapy you go through. If you are trying to pay your bills, you're facing eviction all the time. You don't know how you're going to feed your children. Nothing else matters. It takes away from you. But once you have that situated, that little extra is better than nothing.
Mm-hmm.
Now you can focus on you. So you be in the right mental space to begin to take steps. I was in therapy for at least a year. I was. It's taken me a long time to get out of where I was
Mm-hmm.
and to where I am, to have that presence of mind and the peace. It's never a 9-day wonder. My father always said, anything worth having, you pay a price for.
Mm-hmm.
Anything worth having, you pay a price for.
Mm-hmm.
And so, like you said, a lot of home care agencies are popping up.
Mm-hmm.
And people say, oh, you have home care. Oh, the money is flowing. Oh, the journey, the ups and downs. Remember, we are dealing with clients. Today, you may have 20 clients. Within a 6 months, you can lose 10 clients just like that because they're seniors. They are at the end of their life. It's up and down. It takes everything, takes time. You may not be trying to start an agency. You are just trying to survive. Even that sometimes is a process. You've
Mm-hmm.
got to be patient with yourself. You've got to start doing the work. You got to start looking for information. You got to start today. You have this, tomorrow you have this, tomorrow you have that information. Put it all together and begin to take practical steps. You cannot stay where you have been all the time. From January to December, we can step forward, we can move forward, we can go on. It may not be a leap, but it can be a step. It can be a step. And sometimes all we need to do is go through the steps. And I promise you that if you will take those little steps, you come out of that situation and you look back and wonder, how did I make it through those times?
Mm-hmm.
When you had to go find $20 to put gas in your car. You got to find $20 to put gas in your car to get to work. And now at least gas is not a problem.
Yeah.
There is help out there. There are ways to get out there and get the resources you need without consistently begging.
Mm-hmm. You know what? I know we're almost out of time, but I was just thinking this because I think this is a fabulous idea too. And I love reading. I hope you all read fundamentally and consistently. But I think it would be a great idea. There's so much information there's that we have. You have caregivers that have information that have been taking care of their loved ones. You have healthcare providers that have stories without violating HIPAA. Ebooks are awesome ways to make a decent side income when it comes to sharing information like we just shared. I think this is good content to put in the book, right? So utilize those experiences with sharing those with others and making a side income. I am not going to I'm not going to promote it, but I'm gonna put it in the comment section. I'm not gonna promote it because I've seen it quite a few times and I've not messed with the designer and it's spelled differently. But they say that you can do an ebook and it kind of like a chat GPT thing, and it kind of puts it together with you in less than an hour. So I think it's like a $27 lifetime thing. You can look into it. Like I said, I'm not promoting it because it might not be the right thing. I'm just telling you what I came across and you can go do your research and see what that looks like for you. Like I said, I was going to look into it, but that's all I'm gonna say. That's that disclosure with that. So do your research with that. But writing things, hospice. When it comes to hospice, you all know I did hospice, and that is a big thing for me. As far as nursing, writing what that in the stages look like Queen Edith said, having about in the life, what are they eating well? Are they drinking well? Write a small pamphlet, a know-how, a to-do on these things. You're not going to make $1 million off of them, but sharing the information, even if you have Chat GPT open you, sharing the information, $5 a book, $10 an ebook, it's something. And that's reoccurring passive income, where you're not even having to do anything, but you're contributing to the well-being of society, right? And sharing that information. And it's just a way to make that happen. So that's my last little tidbit on that. I know we're about out of time. You know what I do want to do? I'm gonna let Queen Edith take us out. I'm gonna play this promo real quick. Y'all hold up for just a second. Put your comments in the section. Let us know what you think. Put your comments in the section. Like we said, we're based in Noblesville, Indiana. When it comes to
Peak Home Care.
I always want to mix them up because y'all know we started. Peak Wellness Hour started as a promotion for Peak Home Care Associates.
That's right.
I like to just switch them up. But yeah, we're going to do that. We want to know what you all think. Like I said, everyone's not in Indianapolis. These are things and tools that we want to help you with wherever you are. And again, healthcare is not going anywhere. So it's an advantage to get tapped into something like that. So I'm going to play this quick promo, and I'm going to let Queen Edith take us out. So you all give us a second. List on the comment section what you think. We'll be right back.
Are you caring for an aging loved one and feeling overwhelmed? Let Peak Home Care Associates give you the break you deserve. Our respite care services provide compassionate, professional support right in your loved one's home, so you can recharge with peace of mind. Whether it's a few hours, a weekend, or longer, our trusted caregivers are here to help. From medication reminders and meal prep to companionship and personal care, we treat your family like our own. Take care of yourself while we care for them. Call Peak Home Care Associates today at 317-863-0832 or visit peakhomecareassociates.com, because everyone deserves a helping hand. Peak Home Care Associates, care you can count on, relief you can feel.
All right, so there you go. Any comments? The chat, yeah. Look into that. Yeah, look into if you need home care in the Indianapolis surrounding area, all that good jazz, Noblesville surrounding area. That is who you want to contact. And like you've heard this, Queen, just excellent showmanship and leadership when it comes to her compassion for the care of others. So if you are in the area, great place to be, great place to network with. You do lawn care. We have seniors that need, those kind of things. So let's network. It's not all about the money, but we cannot deny that there is a need for financial balance and well-being. We're not even talking about getting rich or wealthy. We need some sustainability, and our seniors do. Nobody wants to see anybody crashing out because they're caregivers and they can't maintain. It's scary. It can be when we don't want it to be scary. So these are just options that are out there. They don't have to work for you, but it might work for somebody. So let somebody know. Queen has built this empire. I'm sure for a respectable fee, she can help you start your own too. We'll see how much time she has in her hand. She has more time than anybody I know. Right. So God bless her for that. So yes. Just some options for you all. We want to ask that you share these with your healthcare friends, with caregivers, no matter where they are. You all can still reach out to us. If you're not in our surrounding area, you can still reach out if you have questions. We can help. You can definitely reach out to peakwellnesshour@gmail.com if you want to. I don't know. If you don't want to do that, and if you have questions about this conversation that we're having, you can reach somebody. as far as that. I don't want to take up Queen Eve's time. You all calling her to ask personal questions on that work line out of state about something, but she's here for it. Then we just want to make sure we get you to the right place to get those that Q&A handled. So maybe peak1hour@gmail.com might be better if you're out of state and you have questions outside of requiring care from Peak Home Care Associates. If you have questions, we're here for that, and we want to help you grow and build, because again, it's about all of us, and at some point in time, we're all going to need help. It says, once a man, twice a child, and everybody doesn't go through that twice a child phase. There are people that are walking around here right now, 100 some years old, getting around up and down steps, still driving in their right mind. And we have to get there. We want to take care of people that are not there, and we want to do so in a manner where we can stay healthy and not break down and not be overwhelmed. So maybe we can be in that 100-some-year-old stage and we're still good and healthy. I don't want to live that long, and so for those that are not there, it's, for me, it's a reflection of and an opportunity to mirror what's going on and say, what, I should start walking. Queen Edith walks all the time. I should start exercising. I start eating right, because I'm taking care of somebody that didn't have the wherewithal, that didn't have the knowledge and the education that we have now, when it comes to taking care of self and healing self. So that's how I look at it when I'm taking care of other people. That, I hate that thing where it could always be worse. Okay, so here's where we are, and we have to do what we can with what we have, and part of that is being of servitude to other people. We are all in this human race together, and we have to love one another and not leave our elders behind, our seniors behind. So keep that in mind, and I'll let Queen Edith take us out. Queen.
Friends and family, life is happening every day around us, and especially in the season that we are. One of the things I'm hearing is that we should start storing food, dry foods. Mm-hmm. I've heard it a lot. Mm-hmm. And maybe you need that extra money to buy a few bags of fries, a few bottles of water, a few cans of food, whatever it is we need to store. Paper towels, toilet paper, mm-hmm. And maybe you don't need extra money for anything, but you don't have that extra to buy food and begin storing. Mm-hmm. And guess what? Even if whatever it is being anticipated doesn't happen, you have stored for something. Don't wait till the rush when everything becomes so expensive. Mm-hmm. Okay. And maybe you're doing okay, but you're not having savings. What if you do that extra thing for 3, 4, 5, 6 months to a year and say, I'm going to put that $200 I earn every 2 weeks to the side. That's $400 a month. That's money you didn't have before. You could put away. These days, the knowledge abounds. You go on Reels, they're sharing ways to, if you have $500, different ways, different places to put it. Queen G has talked about a lot of things already on this platform. But we need to figure out how we'll get by. Maybe you're a single mother, you're a single father. Afford extra help, or you can't afford help. What are the options out there that will allow me to work around my children's schedule? I love my assistant. She's worked with me the past 1 year. Veronica, she's a mother of
Shout out to Veronica. She rocks. Shout out to her. Oh my gosh.
She's a mother of 4. She's an amazing assistant. We work around her children's schedule. Mm-hmm. There are a lot of home care businesses that may need a little help, and some of it you can even do from home. Mm-hmm. You may have an accounting background. You can start your little on the side, supporting the books of some small businesses.
Mhm.
There's a lot of things. You may have a car, a van. I have caregivers who don't have cars. So for 2-3 hours a day, you can take my clients to places. Connect, get information, get the details. We can't starve and we can lay in bed crying and be depressed. We need to find the real resources. So I can work 4 hours, I can, but if you have a client who needs to go to the doctor's appointment, I have a car, I have a good, so maybe those ones I can do 2 hours, 3 hours here.
Mhm.
Accommodating can be done. We'll talk about it, we'll figure it out. But please, step up. Let's step up. If you know somebody who might need it, because nobody is telling anybody their business anymore. Nobody is. So put it out there. Ask questions. Don't ask questions. Hey, I found out that if you do home care, they can work around your schedule. Maybe we should go find some part time. Have that conversation. You don't know they have a problem, but it's a conversation. We talk about all the nonsense. Let's talk about real stuff.
Mhm. And
So
don't bring trash. Don't bring trash. Not to Peak, not to anywhere. Don't
you
invite
have to
trash.
pass a background check.
Yeah.
Let me just put it out there. You have to pass a background check. You have to be able to follow instructions. You have to follow policy, and all those things will be made clear to you.
There are plenty of people that can pass a background check that have no business working in healthcare. So y'all
Right.
know, if you don't know, everything we say, you can go back and watch this. If you just tuned in, you
Yes.
can go back.
Yes.
If you don't have that,
Yes.
it's compassion and respect for me, number one. So if
Right.
that's not something that jolts you, we're not even talking to you. Don't tell nobody that don't think like that. Please don't share this with nobody that don't think like that. It's okay. We healthcare professionals not need them. Our seniors don't need them. The sickly don't need them.
And you can see
Unfortunately.
the difference between the one who has the heart and the one who's just
Mm-hmm.
there for a
Mm-hmm.
paycheck.
Mm-hmm.
Everybody's there for a paycheck, but some
Yeah.
people have the heart.
Mm-hmm.
So we look for heart, and we've said that all that. Go to the beginning, watch the whole thing. It works. Queen Randa has written it again. The heart. That is so important.
Mm-hmm.
So having said that, let's come together. Let's network. There are so many nuances and different things in this industry that we can all do to support each other.
Mm-hmm.
So let's get it done. Let's get it done. We wish you all the best. We pray for you and your families. Whatever help you need, may you find the resource. And until we come your way next week, please have yourself an amazing week. And remember that in order for you to arise, the basic work needs to be done. Peak Wellness Hour seeks the total wellness of our loved ones, our fans, our followers. So don't neglect you. Take care of you until we come your way next time.
Peace
Love.
and blessings.